Hi, good afternoon again here in Manila. But actually, I would like to thank those people who watch, even if it was just my first vlog. I'm happy. I was expecting a zero audience, but it's nice to know if there are people around who have found time to listen to me. As I said, at the type of audience, I welcome everybody, but to be able to participate, you must be at least a woman or a child, or at least of matured minor, yung sinasabi nila, yung nakakaintindi na, di ba? As I remember, the first time I blogged, I already introduced myself because, of course, it's nice to know to whom you are talking to or listening to, di ba? As I said, I'm also a doctor, but I also, aside from being an OB practitioner, I studied law, and because of that, I knew many things also that is very relevant in the practice of medicine. Now, that is what I want to deal in. And as I said, during my last few years on earth, if natural, if ever, at least I would like to have used the talent or the brains that God has given me to, and the knowledge that I have obtained from medicine and law in order to help other people in whatever way I can. I cannot promise to have all the solutions or answers to your questions or your fears, but at least I will try my very best. And hopefully, kahit pa paano, I would be able to ease your tension, your anxiety, or whatever. See. Now, as I said, I would like to go on. I ended up last time by saying that I would rather the person talking to me to be very sincere and very honest, because how can I really help a person if I do not know all the correct facts? If it is just an imagined or a hypothetical problem or issue, that would not be nice. It's just like watching a movie. If you see a movie, well, it can happen, but of course it is all figments of the imagination, whereas reality is this, diba? And these are things that are really happening and which can happen really to anybody. Well, I chose first as my first topic, which I think is very interesting, because I'm also connected with some hospitals in Manila, and they seek my advice if there would be any problem. I don't have to be physically present there, but at least I can be called upon telephone or a text about some issues, so that the problem will be solved right away. It will not just be allowed to just become bigger. So we try to solve the problem as soon as it's there, no? And that's why I'm being retained by some hospitals. A very, very ticklish issue in a hospital setting is about the patient's right to refuse treatment. We know it most of the time when we are sick, when we have a possible abdominal pain and we think it's appendicitis or gallstones, etc., whatever is the cause, we feel that once you go to the hospital, we leave it up to we leave it up to the doctor to just they'll tell you whatever should be done. If they will give you a diagnosis, and we have, for example, a ruptured or pending rupture appendix, so what you call it, an acute appendicitis, no? In which case you have to treat the patient. Otherwise, it is possible that you might die simply because of this, from infection, among others. We have a well-known celebrity, an actor in the early years, 1920s or so, who died from a ruptured appendix. No? And Valentino is his name, if I can remember right. See? And it's a very unfortunate. At that time, there were antibiotics, but they're not as effective, and even surgery is not as good. We have come a long way from the 20s up to now. Now everything is very, very tactical, and you can have a one-time shop, and then your the doctors know how to treat, how to diagnose. We have a lot of machines that can really very diagnose very accurately what, for example, a patient is suffering from. Like before, neurologists are very much, what to call that, admired, and it is considered a very difficult branch of medicine because you really need all your intelligence, all your past know-how, and your present situation to be able to diagnose, plus the fact that you hope that the patient is telling you the truth. So in order to diagnose between a ruptured vessel secondary to hemorrhage, or maybe there is a blood clot that has prevented oxygen to go up to your brain. So unlike right now, we have what machines, wonderful machines like the CT scan, MRI, and they're able to diagnose right away what is a neurologist dealing with, what is he facing, the condition of the patient, and is able to give the right medicine. And before, when we were much younger or still studying, it's like a little bit like a guesswork. Let's try this, and if it doesn't work, then we'll try the other one for the other treatment, kind of treatment. But now with these machines, of course, they are more or less accurate because they are machines, no? And as long as they are maintained properly, calibrated, there's no way that they will be erroneous. The human factor is not there. And like before, you do a CBC, what do? It is the medtech who does it. And if the medtech is either incompetent or distracted, human error, they can easily make a mistake. But now you just put your blood specimen inside the machine and it will accurately reveal the result. So yun ang advantage now. Now going to that, I said that it's not interesting to know if a patient can refuse treatment. Well, of course, there are two important conditions that you must see in the patient. The patient must be competent. Competent means of adult age, not a minor therefore, and of sound mind. In other words, you know that he can really decide to what to do with his body, because that is a right. We have the right, the patient has a right to determine what is to be done to his body. But as we have said, this is not an absolute right. According to the courts, of course, if it's really necessary that the doctor interfere, for example, you refuse treatment, you want to be sent home, you don't want to be admitted, but the diagnosis, as I said, is COVID-19 and very serious. If you just let go, you're experiencing difficulty breathing, or what we call dyspnea, a possible onset of pneumonia. So, delikado yun. And that is where the court said that here the physician can really interfere and intervene, even though you don't want to be admitted. If you have to be admitted, there is no choice. So other situations when they affect the health of other people, and also with regards to certain diseases, they are to be reported also to the proper health authorities, like those from the DOH. These things like maybe AIDS or HIV, but always maintaining data privacy, always maintaining confidentiality between the doctor and the patient. So, as I said, it is not always absolute, this right to refuse. So the condition must be, you must be confident, and it must be an informed consent. In other words, you were waiting for the consent of the patient that I do not want to be treated, but he is entitled to be given all the conditions must be that would make him make a rational decision. As for example, pwede sabi mo, I just want to go home. The doctor didn't tell me that I cannot go home, or that if I don't submit to this operation, I might be permanently disabled or might even die as a consequence. So it must be an informed decision. And in order to protect the doctors, the hospital requires that the patient sign what we call an informed consent. But it must be proven there that the doctor at least mentioned what is your illness, what is the nature of your illness, how serious is it, uh, what are the effects, what are the treatment or medicines to be recommended, and if you refuse, what are the consequences, and if there are other alternatives, is it safe enough to just go home, for example, and refuse treatment or admission. And very important. So we define this as informed consent. Okay. Now, well, of course, aside from this, as we have said, if the patient must be of the right mind, at least conditioned mentally, in order to be able to satisfy this informed consent, because sometimes the patient is in extreme anxiety or extreme fear of his condition that he is not, other persons or especially doctors will say, may judge her or him as incompetent to give a good decision. For example, if the patient comes in severe pain and it's suspected she might have an emergency condition like ectopic pregnancy, which if you just let it go and send the patient home, the tube or the which contains the fetus, for example, still very small. It is usually occurs in the second month of pregnancy, and it's possible this will just rupture, and so the patient will certainly die. Now, these are things that are emergency, and sometimes even though the patient says, "No, I do not want to be operated on, nothing," because of the extreme pain and the extreme anxiety which she presents, this might not be considered as a reason to accept her decision not to be touched or operated on. See, because of the condition that she is facing, she might not be considered legally as competent to be able to decide because of the things that she was feeling at that moment. So that's why it's very important to know when it is right to be able to give consent, and when this will be recognized. Now, unfortunately, in the Philippines, I don't know with other countries, but here, verbal consent is considered also a consent. In other words, for example, the patient will call you by phone, and then the doctor says, "Oh, let's just meet at the emergency room or in my clinic now," and then you went there. Okay, even without any written papers, etc., that is considered, in a way, consent for you to be admitted, and you're resigning yourself to whatever decision your doctor makes. So that is allowed. But of course, as I'm sure you must have gleaned beforehand, earlier, that that's why we have written consent, more for the protection of the hospital and the attending doctor. And it's also wise if you have your other family members present and they listen and they are able to glean that the patient is competent and is able to know what's going to be done to him or her, and still refuses to abide by the suggestion of the doctor. But it's always wise also to have a witness to this resignation or as a decision of the patient. And of course, get a witness not on their side, because then that witness can always change his mind and eventually mas kakampi siya with her relatives, I guess, not with you, who's practically a stranger to him or her. So also, so ganon. So better get a witness, maybe one of the staff of the hospital, the nurse, or it may be an orderly or an attendant. At least they knew they can witness the fact that you did inform the patient, you gave all the conditions, the requirements that must be done, and why it should be done, on other possible alternatives, including the fact that she can refuse the treatment. So with that, at least more or less, you are protected pag may signature. But there are, however, cases when, as we have said, because of anxiety or because of the patient is unconscious, she cannot really give a correct consent, no? But what you call the dot in the dot emergency doctrine, or in this particular case, you're expected to do what you can for the patient. In other words, if the patient thinks that the doctor thinks that he has to be operated on because the patient is going to shock because of extreme bleeding because of a ruptured ectopic pregnancy, for example, then you go in. You don't even have to get the consent of the next of kin, etc., because it is expected. And by the patient himself, had he been alive, conscious and alert, that you will do everything to save the life of that patient. And since you've saved the life, of course, later on you can charge accordingly. So that is the most important thing. Now, what about minors? No? Minors in the Philippines is anybody below 18 is considered a minor, although in the States, and we sometimes recognize it here also, what we call a matured minor. In other words, from 15 to maybe to below 18, especially when they get pregnant, more or less may alam na ito, nakakaintindi na, you can already understand things. So this one is there's always what you call the parental authority coming from, oh, there's a telephone. Maybe I should stop this one and continue next time blogging about the rights of a matured and even a very young child below 18. See you again next time.